Hey, it's Dr. Shelley, and you are either about to get your DaVinci assisted hysterectomy with or without removal of your ovaries, or you just had it. And so, what do you expect after the surgery? So, the surgery itself, the great thing about the DaVinci is that it is done laparoscopically and with the DaVinci. So, there is actually less pain than traditional laparoscopy and way less pain than with open laparotomy where we're cutting through muscles and tissue. Um, and also less blood loss. So people tend to feel really great after their surgery and actually have more trouble with telling people to take it easy than the other way around, where they're sitting there in a lot of pain. It's all about getting the gas out, and that's my goal at the time of surgery is to get as much of the gas out as possible. And the Da Vinci instruments are made to do that even better than the typical laparoscopic ones. So, like I said, a lot of people after Da Vinci hysterectomy or any Da Vinci surgery are sitting up looking just like this. It's like you wouldn't even know which one had the surgery done. So, even if you feel like $1,000,000, your body knows you had a major surgery, so you got to take it easy. So you should have a prescription already for a nonsteroidal. That is the number one thing that you need to be using. So either you have a prescription from me or you already have at home for Celebrex, 200 milligrams twice a day is needed, or for Anaprox double strength. 2 to 3 times a day as needed, or for ibuprofen 800 milligrams 3 to 4 times a day as needed. So what I want you to do is, if it's a Celebrex, you're going to take it twice a day for 3 days, whether you're feeling pain or not. The ibuprofen, you're going to take it 3 times a day for 3 days, whether you're feeling pain or not. And the Anaprox, it's 3 times a day for 3 days, whether you're feeling pain or not. And then after that, you can continue to take the nonsteroidal, but you only take it as needed. But that way, right after the surgery, you're giving yourself some degree of pain control every single day versus waiting for the pain and then being reactive. Much easier to be proactive with your pain relief, especially right after surgery, than reactive. Now, you have a prescription for a narcotic, or you already have your narcotic prescription at home. Now, the narcotic, especially if you got sent home the same day of surgery, we don't want your poor family members worrying about you and fretting. So, my goal usually is for the first 12 to 24 hours to keep you kind of high and happy. So I would recommend that you go ahead and take your narcotic, usually it's Percocet or oxycodone, hydrocodone, and take that um, every 6 hours for the first 2 to 4 dosages. Not that they wake you up in the middle of the night to stuff it down your throat, but that it's available so that you decrease, like I said, their anxiety, especially overnight. Um, and then after that, I want you to stop taking it and use it only as needed. Now, if you're absolutely having no pain at all, certainly you can wait to take the narcotic, because there are people that do not require narcotic at all. So it is possible that you're one of those people. But like I said, try to be proactive with your pain relief versus reactive. Now, after the first 24 hours, you really should not need narcotic, okay? And if you keep taking it around the clock every 6 hours, you're going to develop constipation, which is going to create a whole new kind of pain that you weren't having. And that's rubbing salt into the wound. So I'm not saying you can't have a narcotic after that, but you should not take it automatically for sure. Also, the narcotics goal is to make you high and sleepy. So you cannot take the narcotic and try to sit there and work on a computer or read a book or watch TV. Or you're going to start to feel kind of sick from trying to concentrate while you're high. Now, if you want, especially after the first 24 hours, if you want to take the narcotic, but you don't want to be completely out of it, you can actually cut that pill in half. You can cut that pill in a quarter. Okay, so you can reach for the narcotic after that if you need it, but you should not be taking it, like I said, automatically after that. That's the joy of Da Vinci. You should not be in excruciating pain for extended period of time. Shouldn't be excruciating pain, period. So that's how we do it. The You are free to drive 4 days after the surgery. And so you can drive yourself to your post-op appointment if you're feeling okay. Now, when you do come for your post-op appointment, which is usually a week from surgery, you are going to be doing probably more activity than you've done since your surgery. So I do want you to take your nonsteroidal pill, even if you're not having to use it otherwise. Take it that morning with some food, so that you are ready for when you come to the office, whether you're being driven or whether or not you are driving yourself. Obviously, the rule with being behind the wheel of a car is that you should be able to function normally. If you are walking like death's doorstep, or you are in a lot of pain and you are therefore afraid of being behind the steering wheel of the car, guess what? You shouldn't be behind the steering wheel of the car. Okay. So the whole point is that you should be able to drive responsibly. If you're busy worrying about protecting your belly, and whether or not it's going to hurt if you get in a car accident, you may behave differently behind the wheel of a car than you would on normal circumstance, and put other people and yourself at more risk of accident. So if when in doubt, don't drive. But otherwise, if you're feeling pretty good, you're certainly welcome to after the 4 day mark. You should not do heavy lifting for at least 2 to 3 weeks. It depends on how big the incisions are, but usually it's easy to say that you shouldn't be lifting anything over a big gallon jug of milk for the first 3 weeks. So nothing over 20 pounds. And so it doesn't mean you can't do stuff, but you shouldn't be crawling up under the bed to pick the shoe that rolled all the way underneath, and you shouldn't be trying to fix dinner for everybody in the house, and or like some big meal and lifting heavy pots and pans and stuff like that. It does not mean that you can't get up and make yourself food, and or something, get yourself something to drink. I don't want you laying around in the bed not moving. You got to move, or else the gas gets stuck, and that creates, once again, a whole nother level of pain that you shouldn't have to deal with. You can certainly go for walks, but remember, wherever you go, you have to get back from. And the body will register, even though the Da Vinci doesn't cause a lot of pain, your body still knows you had a major surgery. So you can hit a wall of fatigue. So if you're one of these eager beavers and you think you're going to go back to work after a week, yeah, you can. But what'll happen is that you once again can hit a wall, usually about a week back into work, where you're suddenly like, oh my God, I'm super exhausted, super tired, I'm just in pain, I just don't know what to do with myself. And it's because you pushed yourself too fast, too far. So take the time, if you have it, to relax and just enjoy. And like I said, you don't have to stay bedridden, but there's no reason why you can't use that time to do some reading, relaxation, watch some TV. And if you want to do some work from home, do a couple of hours, but be able to start and stop whenever you want. Obviously, if you're requiring narcotic, should you be doing computer work and doing executing work for your job? No, because you're high and you could be making decisions that are not good ones. So if you're to that level, you shouldn't be working. And then I always tell people, your job's not going to file bankruptcy unless it's your own business, if you're out for 2 to 3 weeks. And it's better to take the time off and recover and then go back at 100% or as close to that as possible than to go back and expect sympathy from your coworkers and from your employer. And because once you're there, you're expected to perform. I don't care what they say. So that's my recommendation for that. As far as work, as far as lifting, as far as sex, nothing goes in your vagina but me for 10 weeks after DaVinci hysterectomy. And I am firm on that, okay? And that's so your wound has time to heal all the way up, and we don't have to worry about anything, what's called dehiscence, where your wound opens up. If your wound opens up, that buys you another surgery, and can lead to some funky stuff, and eventually will delay your long-term recovery significantly. So do as I say. Um, you know, nothing inside but me for 10 weeks. If you want to do something on the outside, that is up to you. But no fingers, no tampons, and certainly no penises inside of your vagina, and no toys inside of your vagina for 10 full weeks. Okay? We've had no problems. We don't plan for you to be the first. We want you to be all nice and healed so that when you do resume activity down there, that you don't have to worry about it. Now, the caveat to that, I may give you something during the post-op period, like some estrogen cream or something like that to help with healing, or an antibiotic cream or something, but that would be, I will tell you that specifically. But otherwise, don't you decide on your own that you're going to put something up into that vagina. No, no, no. As far as what you need to call me for, okay, we expect to have a little bit of bloody, watery discharge. As long as there's no funky odor, and of course, old blood can have a little bit of a metally smell, but you should know what that is. But nothing, foul smelling, no heavy bleeding. You should not be filling your shoe with blood. You should be not bleeding like a period, but a little bit of spotting, light pad, especially if it's watery, completely normal. Remember, a drop of blood in the toilet will look like an ocean. So make sure it's actually something coming out onto a pad if you are seeing it. We don't want to have pain with urination. We don't want to have urinary frequency. You had a catheter in your bladder. Sometimes you're going to get a little bit of bladder spasm initially, but it shouldn't hurt. And you shouldn't be running to the bathroom every 5 seconds. If so, you may have developed a urinary tract infection, and we will treat that for you. Um, so we went over bleeding, discharge, and urinary tract infection. Obviously, we do not want a temperature greater than 101 degrees on 2 separate occasions. A low-grade fever every blue moon, that might just be first of all, if I've taken out your ovaries, even if I haven't, you may be developing hot flash, and it can make you feel a little bit warm or clammy. But if you're running high temperatures over 101 degrees on 2 different times, then certainly I need to know that. Okay. Obviously, severe nausea or vomiting. Once again, you're taking pain pills, you're taking narcotics, you can get a little bit of nausea, stop, eat a little bit of food. If it goes away, that's fine. But if it's not going away, or if you're throwing up, I need to know that. And leg pain. We don't want leg pain, like especially in our calves. That could be potentially a blood clot back there. So if you're having significant leg pain, it's not going away, and then that would be a reason, even if you don't feel a mass, to let me know. Shortness of breath, chest pain, not normal as well. Also, even if we left your ovaries, sometimes you can start to have significant menopausal symptoms. If it's a mild hot flashes, night sweats, difficulty sleeping, or heart palpitations, then that's okay. I'll see you at your post-op. If you're drenching the pillow, ripping everybody's throat out, and or feel like you're about to have a full-fledged anxiety attack, let me know. Let's see what we need to do to step in and help your symptoms ahead of time. So I think that covers everything. You should have an appointment. If we did the a total hysterectomy, you should have an appointment for 1 week following surgery, 3 weeks following surgery, and then a 10-week following surgery. Now, when we're doing hormonal therapy in the middle of that, we may throw in some extra visits, but those are your three postoperative visits where I will examine you. The first visit, you do not get undressed. We're just looking at your belly unless there's some significant concern that requires me to look down below. Otherwise, you will get undressed from the bottom down for your third visit, and of course for your 10th visit, because that's the visit where I tell you that it's free to use the machinery again. So I think that covers everything. If I forgot anything, please give the office a call. You can certainly hit with your surgical scheduler, because she knows what's going on with you. And there is an after hours emergency number. Feel free to reach out to me if you have significant concerns. And otherwise, I will see you at your post-op appointments. Take care.